Welcome to the Healthcare Executive Podcast, providing you with insightful commentary and developments in the world of healthcare leadership. To learn more, visit ache.org. And without further ado, your host, Chris Caraggio.
Hey folks, welcome to yet another Healthcare Executive Podcast. I am your host, Chris Caraggio, and the episode title, very appropriate for the times that we are in right now. It's called Lessons from the Front Lines of COVID-19, and we have a very appropriate guest in Warner Thomas. We're going to start our conversation in just a moment, but first let me kind of read you Warner's bio so you can get to know him and what he's accomplished. He's the CEO for Ochsner Health. That's Louisiana's largest nonprofit academic health system and its largest private employer. He was named CEO back in 2012 after 14 years as President COO. Now, as Louisiana's largest nonprofit academic healthcare system, Ochsner provides coordinated clinical and hospital patient care, all connected electronically to provide convenience for all the patients across the region by Ochsner's 41 owned, managed, and affiliated hospitals and specialty hospitals and more than 100 health centers and urgent care centers. Now, Warner has been instrumental in something specific, developing a population health focus at Ochsner. That's delivering programs and resources that empower patients to effectively manage chronic conditions while also maintaining focus on preventative measures. Also screenings and education to help people just stay well and avoid preventable disease. Now, additionally, he launched Innovation Ochsner, Ochsner's innovation lab designed to create health advancements and revolutionize patient-centered care. Again, he's a very appropriate guest for this episode. Now, Warner is dedicated to service to healthcare. He was appointed to the Medicare Payment Advisory Commission in 2014. He has served on numerous boards, including currently as chairman of the American Hospital Association section for Health Systems Governing Council. He received his undergraduate degree in accounting and computer information systems from New Hampshire College and his Master of Business Administration degree from Boston University Graduate School of Management. Now, among his many honors, Mr. Thomas has received multiple awards for from the Anti-Defamation League, from Glassdoor, Ernst & Young, and yesterday we saw him at the White House Coronavirus Task Force press briefing. So we are pleased to welcome in Warner Thomas. Warner, thanks so much for being here.
Hey, it's great to be with you.
You got it. Okay, so before we kind of get into our conversation, you were raised in Vermont, right? In rural Vermont, and you started as a CPA. How did you kind of transition into healthcare?
Well, it's kind of an interesting story. I grew up in a small town in Vermont and went to undergraduate school and studied accounting and computer information systems, had a double major. And really started Ernst & Young, and my original clients, I had a number of clients to begin with, but over time started to specialize more in healthcare. And after about 3 or 4 years at E&Y, I left and went to work for one of my clients in healthcare. And since then, I've continued to grow and develop my career from a healthcare perspective.
All right. Okay. So that's how you got on this road. And again, we appreciate you being on it, especially here in this time we're living in, obviously in the midst of the COVID-19 pandemic. So right now, I understand you guys are currently treating patients in 20 of your managed and owned hospitals while also working with everybody across the Gulf region, all your partners. So we appreciate you, again, taking some time out from the front lines and kind of share what's going on. So having said that, Warner, tell us a little bit about Ochsner Health, and then also, where we are right now with this pandemic in general to start.
Sure. So Ochsner Health, as you indicated, is the largest not-for-profit health system in the Gulf South and also the largest health system in Louisiana. We have a large clinic practice. We employ about 1,500 physicians, and as you said, we own or manage or affiliate with about 40 hospitals. We're primarily, our headquarters are based in New Orleans. That's our largest market that we serve is New Orleans. And certainly that's been impacted. New Orleans has been impacted significantly with the COVID-19 virus. Ochsner has had a long history in this integrated model of care of a group practice, and started as a group practice about almost 80 years ago, and then evolved into more of an integrated entity when it started building and owning hospitals back in the 50s. And so we've continued to advance and develop that integrated model over the past several decades. As we have entered the past probably 7 or 8 years, I took over as a CEO in 2012, and really started building partnerships with many hospitals around the region in order to help them deal with the challenges of the Affordable Care Act, but also to build common allies to move down the road of population health, move down the road of improving healthcare in our state, reducing cost. And that's why we've had a very big population health strategy. We created the Ochsner Health Network 4 or 5 years ago, really geared with some of our hospital partners and over 3,000 physician partners. And we've continued to drive the healthcare agenda in the state of Louisiana. As it turns to COVID-19, New Orleans has been one of the hot spots over the past several weeks. We started watching this closely at Ochsner, back when we saw the escalation in Wuhan, and as it hit the northwest area in Seattle and the Washington area. And we had started planning, several months ago, thinking about how would we deal with COVID patients, how would we deal with, PPE, and once again, there's no COVID-19 playbook. Nobody can go to the bookshelf and pull it off and say, okay, these are the things to do. So I think our focus on being, we hear a lot about agility, but I think this idea of adjusting and adapting to the environment and what's happening is critical to success in any situation, but certainly in this situation of having a pandemic. I think we've been able to respond appropriately because we prepared, but also we adjusted and adapted as the situation, warranted. So,
well, obviously you just said you adjusted and adapted, very important in this time, but you also said there's no playbook. So, our listeners will probably be interested in your role as a leader in this crisis. What do you have any specific must-do tasks right now that you apply every day?
Yeah. So I think, and I got asked this a lot in Hurricane Katrina, because we went through Hurricane Katrina and we were one of 3 hospitals that stayed open and took care of thousands and thousands of patients when the healthcare system was really significantly impaired in the New Orleans area. And as I told folks then, and to me it's the same situation now, is this planning starts years ago by building a good team and by investing in your team and having people that are well prepared, that are confident, that have good skills, that work together as a team, and are people that can make good decisions and do that in challenging times. And you find that very good leaders do extremely well in these types of situations. They flourish and they make good decisions and they do a great job leading their team. And those that are more marginal, I think, are challenged and have more difficulty. So this all starts with building a great team, quite frankly. I think second is, I would say it's about communication. Early on, we started having, we set up a small command center. We put the right people in the room to decide how we're going to adjust to this. We continued to monitor and change our approach, based upon the number of patients that we had coming to our, organization, and how the environment changed once schools closed and once we kind of had the shelter in place. And I think communication, multiple times per day with our leadership team, probably our top, 100 people in the organization. And then communication, weekly with employees, with leaders, with our partner hospitals, twice a week communication with our board. Because this is a time when things are changing all the time, and we may be making good decisions, but if we're not communicating them effectively, then we're not going to be able to be as effective as an organization. So I think communication is really critically important. I think the third item was to really just understand the situation that you're in. Like, what is happening around you? Do you have good information about numbers of patients? How many people in your facilities? What are the issues at your facilities? How are you moving resources around? And that's what that, twice a day communication with our top 100 people was all about, is where did we have a hot spot? How do we move and adjust to that? If we didn't have PPE at an adequate level, how are we going to adjust that? How is supply chain helping our staff? Where do we have staffing needs? I mean, these are all things that are addressed on our leadership call a couple of times a day. And, if you look over the past month, I mean, we've treated, well over 60% of the patients in New Orleans who are COVID positive. And we've been treating, probably somewhere between a third and 40% of the patients in the state over the past couple of weeks. And, our census got as high as, probably mid 800 COVID positive patients in our facilities. We're down now under 700. So we did work through the peak and have started to trend down. But, things like opening 110, ICU beds in a 2-week period of time, moving 2 or 3 of our med surg units off of our main campus into one of our long-term acute care facilities to allow more capacity and to move those rooms to ICU beds, staffing them appropriately. These are things that there's not a playbook for it. You have to adjust and adapt to what's happening and have the leaders that can execute that.
Obviously, you talked a lot about communication with your staff, with your top leaders. How, especially right now where we are, Warner, what about communicating reassurance? How often, you said you passed the peak, but how often, maybe in the last month or so, and as we continue on, have you had to provide that reassurance, and how do you encourage, just kind of keep moving forward?
Yes, that's absolutely critical. I mean, all of the messages that we have would start and end with, we are going through a challenging time. We're going to be okay, and we're going to make it through this. We're going to get on the other side of this, just like we have other challenging times that have come before us, whether it's the financial crisis, whether it's Hurricane Katrina, whether it was Hurricane Rita that we went through, whatever the situation, we will get to the other side of this. And people need that reassurance. They need to understand that, hey, we got a plan, and we would go through, hey, these are the high-level things of what we're doing and why we're doing it. I think it's important to not just tell people what you're going to do, but why you're going to do it and why that's a good decision. Because I think folks, they may not always agree with you, but if they understand the why, many times they can get their head around, the decision and what's happening. So I absolutely think that that's part of it. And you're right. I mean, sharing the positive news that's happening, because, when you're going through a scary time, and, last week, probably about 10 days ago, we started talking about the flattening of the curve. And then last week really started to report, the numbers of patients that were being discharged COVID positive and going home. And it was growing by 60 to 70 a day. And now, as we sit here today, it's about 1,200 that have left our hospitals and have gone home COVID positive. They've made it through this. The numbers of folks that are being, not just intubated on the ICU, that are being extubated and leaving the ICU, going to our med surg units. So sharing those positive stories and helping people understand that we're making progress is so important when you're going through an uncertain time, and communicating the things we know and communicating the things that we're unsure of and will continue to monitor, I think is another key component as we think about this.
Yeah, I think it's that balance of, reassuring and positive things to say, but also the cold hard facts, right? I mean,
correct.
And that's what we've been doing as a nation, hopefully, and certainly for you guys in the thick of things down there in Louisiana. Have you guys had to, talking about staff, have you had to redeploy any, a lot to manage through this crisis? How have you organized that?
We have redeployed a lot of people. I mean, we have a huge, ambulatory, services and clinics, and we've seen our services in those areas down probably 65 to 70%. So that's obviously been a big challenge. So we've redeployed many folks from our clinic to be supply runners to our floors. Many of our medical assistants in our clinics are now being, nurse assistants in many of our inpatient units where we've had, tremendous growth in inpatient census. Our critical care docs have done a great job managing the ICU, but our surgeons and anesthesiologists are, surgeons, many of them, especially some that have come out of training recently, have more experience in managing ventilated patients and working with the anesthesiologists that have that background. So they've been deployed differently. So it absolutely has been a process. And even folks in our corporate areas who have been redeployed to do temperature checks going into our facilities, to work on loading docks, helping us with more PPE that's coming in, working in our supply chain to help us in areas there. So we have absolutely redeployed a lot of folks around the organization. And I'll say that people have been very flexible. I think they are appreciative of stability. We have not laid off or furloughed people at this point. And, our principles are around job security and job prevention, around stability, and then around stability of the organization. So obviously we can continue to do the things that we need to do. So we make our decisions as we think about that, and having a stable organization so we can take great care of patients. Because if you're not stable and in a great place as an organization, you can't take great care of patients, which is why we exist. So I think these principles are important for people to understand. So.
Yeah, everybody kind of has to get on board and do a lot of different things in this time. A lot of folks aren't privy, obviously, as you are, to what's going on maybe in a hot spot. We see reports on the news of New York, and we see reports from Detroit, and obviously from New Orleans, and maybe from Florida, early on from Washington State. What have you had a chance? Obviously, you're seeing it. You're on the front lines. That's why we're doing this episode. Just by where we are right now, even I know we've never been through anything like this, but have you taken a moment really to step back and look at your organization, and are you amazed that things have gone as smoothly, and just like the staff, everybody kind of doing something different as well as what they were schooled to do? Is it time for you? Has that dawned on you yet, or will that come later, where you kind of look and go, man, we really did the best we could, and I'm proud of the staff?
I absolutely have done that. I mean, I'm not surprised, because we have such a great team, and our physicians and our nurses and all of our clinical team folks are just so professional, so well trained, and I think frankly are crisis tested. We've gone through some challenges, and so the interesting thing about going through those challenges is that you can do it, and you can get to the other side. So I think that's a really important learning lesson from a career perspective, or anytime you go through adversity. When you're going through it, it's very challenging. When you get to the other side, you realize it was a good learning experience, and you have those lessons now, when you move forward. So, I think we have handled it well. I mean, you can always Monday morning quarterback and say we could have done certain things different or better, but I think we've done a great job taking care of our patients. We've done a great job being a huge resource to our city and to our state. We've done a great job, keeping our employees safe and making sure they got the right PPE. It's amazing how many people have come to work with us over the past couple of weeks, because we've done such a great job on taking care of our employees and making sure they have a safe environment, have the equipment and the safety protection that they need. So this one, as I said, was different. I mean, our supply chain people, working with a local distillery to make, hand sanitizer, our innovation auctioneer group, they heard we had face shield issues, and so they 3D printed, some mock face shield, and then worked with a local company to start producing, our own face shields, and now producing things several thousand a week. A local clothing company that I'm not even sure, frankly, how we made the connection, but we were able to get the right material for surgical gowns and masks, and they've been making surgical gowns for us over the past several weeks. And not that supplied everything that we needed, but it was a supplement and has been helpful. And these are things we've never done before. I mean, when they came to me and they said, "Oh yeah, our supply chain people just worked on this and worked with our clinical people," and I was like, wow. I mean, that's innovation, that's creativity, that's drive, that's being a self-starter. No one asked folks to do this; they just went and did it. And so I know there's lots of examples of that in many healthcare organizations across the country, but I think it just goes to show you the invention, the ideas that can be generated when folks are going through a challenging time. And I think there's been a tremendous amount of creativity in this whole process.
Let's talk a little bit about, Warner, what we talked about, you helped develop, the population health focus at Ochsner, specifically for vulnerable populations going through this COVID-19 pandemic. How do you reduce the impact, or do you reduce the impact to these vulnerable populations?
Yeah. So we've been working on, population health and what I would call helping people live healthier, more productive lives, robust primary care, being best in practice at ambulatory quality measures, and all of our measures around screening and hypertension control and diabetes control. I mean, we rank, at or near the 95th percentile from an NCQA perspective in all of those measures. When we do the Medicare, Advantage, Medicare Share Savings, we're always scoring very high from an ambulatory quality perspective. And, I think what we're seeing is, in COVID patients, I mean, it is folks that have hypertension or especially diabetes. It is folks that have BMIs that are, generally in excess of 25 or 30. And if you look at the percentage of people being admitted and the percentage of people that end up going to our ICU, the percentage is somewhere in the neighborhood of 55 to 65% have BMIs, over 30. So this is all about preventative care. It is all about helping people live healthier, more productive lives, and we all have to do a better job of it. And I think one of the challenges we run into as a society is we never think it's going to be us, right? Hey, I can push that off, and it's not going to be me. It's going to be my neighbor or the next person, and so we don't necessarily think about it until we have a problem. And so, not that any of us want to go through the pandemic, but I'm hopeful that maybe one thing that'll come of this is that we all do a better job taking care of ourselves, and we all do a better job on personal responsibility for prevention. And then the healthcare systems, have to keep working hard to do a good job on, ambulatory quality and managing chronic disease, which, frankly, historically, the healthcare system has not been good at that. So I'm proud of the work we've done there. David Carmouche heads up our population health and Ochsner Health Network, working with our partners, and he's a physician by training and has done a lot of work in population health. And I think has really helped to push us to new levels there. But look, we can always get better, and we can always make sure we're addressing new regions, new populations, and that's going to be a goal for Ochsner going forward as we really set a stake in the ground to help Louisiana be a healthier state.
Post-crisis, since you that's where we are right now in this conversation. Since we've never gone through anything like this, obviously everyone's learning every single day, and the hope is that we're gonna be better in so many areas coming out on the other side. Those are the silver linings that we all hope to see and to live through. So let's talk about quickly the future. Your thoughts about how healthcare overall will be changed due to this.
Yeah. So, I'm hopeful that we'll do a better job on the, outpatient and ambulatory side, as I said earlier. I mean, my first really big concern is that the economic toll that this pandemic is going to take on health systems and hospitals across America is absolutely massive. Now, I know that it's massive on the airlines and it's massive on lots of business, hotels and casinos and restaurants and whatnot. And I totally understand that and appreciate that issue. But what's happened with us is, and with hospitals, we've had to spend inordinate amounts of money to staff, to get equipment, to expand capacity, to get protective gear for our employees, and spend money in ways that we, were not spending money before, at a time when all of our elective cases and things that really help us be financially stable are gone. And I think I think the CARES Act that's out there, and the first payments that came about a week ago, and I think the second payments are coming in a week or two, is going to be helpful. But I still think the economic toll on health systems and hospitals and physicians is going to be massive, and I worry about what that does to the industry going forward, and how does the industry come out of that. So that's kind of a global kind of macro issue that I'm very concerned about. Hopefully there'll be additional stimulus money that helps shore up hospitals, especially areas that were tremendous hotspots. But even the ones that weren't hotspots had to shut down elective cases and have seen very significant financial losses. So assuming that gets sorted out, we can make our way through that. I am hopeful that one of the things we've seen through this whole process is a lot of collaboration. In New Orleans, we took the lead to bring the other health systems together in New Orleans to have daily calls as we were going through the increasing number of cases to the spike of, how we could work together and how we move patients around and sharing information. And we create a model kind of projecting the number of cases we were going to see. And I think it was really great collaboration. And I'm hopeful that we'll see more of those types of things in the future, and more collaboration amongst, physicians and health systems to do a better job taking care of our communities and have a more kind of common voice and approach to healthier living, healthier lifestyle, and proactive care, not reactive care. I think healthcare has for so long been reactive about fee for service, and when people call you or they come to the ER or they need help, you're reacting and taking care of them, versus proactive care, which is doing health risk assessments, reaching out to people to make sure they have their screenings done, making sure they've got their diabetes and hypertension under control, and doing outreach versus waiting for folks to come to us, and really moving to a place where we use data. We've now digitized all this information in our electronic medical records. How do we really put that to work to become more predictive? Can we predict people that are going to have diabetes or hypertension? Can we predict when they're going to be in control or fall out of control? How do we predict more chronic disease if their air quality is down in a community and we have air quality measures? We know ER admissions are going to go up for folks that have any sort of respiratory disease. And I think this is a different approach to how we think about caring for people and caring for communities. And I'm hopeful that maybe this is an event that triggers some of that bigger thinking about population health and how we take care of the communities that we serve in a broader way.
Yeah, hopefully what you're saying is that collaboration leads to innovation, right? And just maybe we're going to find, like you mentioned, maybe we're going to find different ways to experience positive outcomes throughout this. That's the hope, right?
I think that's the hope, and I think it should be our goal. I mean, once again, we exist to take care of people, and I think we exist to take care of people not just when they're sick, but we exist to take care of people and help them live well. And I think that's going to be, because once again, I think COVID-19 was has been more devastating to folks that do have chronic disease. And look, it impacted all ages and all walks of life and whatnot. But folks that did have much higher body mass indexes, or folks that were having chronic disease, especially diabetes, they seem to be disproportionately negatively impacted by COVID-19. And so these are things that we've got to work on as individuals, and we got to work on as health systems to help individuals understand how to continue to take better care of themselves.
Well, you guys are certainly doing your part, Warner. We appreciate all the hard work that Ochsner and other healthcare providers are doing during this pandemic, during this crisis, this critical time. And thank you so much. We know how busy you are, especially now, but for taking so much time on this podcast to really provide some insight and some great information and some hope moving forward.
Happy to do it. Thanks for the opportunity, and you and hopefully everybody out there stay safe. So thank you so much.
You too. Okay, that was Warner Thomas. And folks, thank you so much. And join us once again for another Healthcare Executive Podcast. I'm your host, Chris Coraggio. Thanks for being here.
This has been the Healthcare Executive Podcast, brought to you by the American College of Healthcare Executives. If you've enjoyed the show, please consider rating and reviewing on iTunes or your podcasting app of choice. And for more information, find us online at ache.org.